beginning of the measles outbreak. For the first time in 20 years, children are dying. That doesn't look like making us healthier again. In fact, a lot of people want to talk about measles, but the plague is back now.
Jasmine Crockett didn't hold back. In a fiery hearing, she accused the Trump administration and RFK Jr.'s health agenda of making America sicker, not healthier. From rising hunger and farm bankruptcies to vaccine policy and Medicaid cuts, Crockett delivered one of her most explosive speeches yet, warning that the consequences could cost American lives.
Okay, Ms. Crockett.
And Mr. Chair, before I begin, I do have two UCs that seemingly work really well right here. One says farm bankruptcies in 2025 already exceed 2024 levels. That is from Hoosier Ag. And the second one says farm bankruptcies rising in 2025. All right. The reason that I wanted to talk about farming is because it seems like we think that we can talk about things in some sort of vacuum. You can't talk about healthy children if you don't talk about whether or not they have money to access any food, whether it's good or bad. Some would argue that if you don't have money to access food at all, whether it's good or bad, it's probably bad for the child to not have anything in their body. The reason that those on my side of the aisle keep bringing up these cuts is because we know that we already have a hunger problem in this country. Considering the fact that we have a hunger problem in this country, it's now only been compounded by the poor policies of this administration and House Republicans as well as Senate Republicans. You see, I don't believe that you can just have a mantra where you say, make America healthy again, without actually doing the work, because as the good book says, faith without works is dead. So let's talk about the work that really needs to be done. Number one, it's in policy. Policy that doesn't look like ridiculous tariffs that unfortunately now have our farmers going under. In fact, to be very specific, farm bankruptcies are up 55% compared to 2023. Which minimizes the amount of food that we do have that will be available. And ultimately, that food will be more expensive because that's simple economics. Yet at the same time, the $6 a day that people get to eat, that's going away. And besides the SNAP benefits themselves, we're talking about those kids that only get their food at school. And we are able to set the guidelines for whether or not that's healthy food or not. The reality is that I am so disturbed because under this Department of Health and Human Services, literally, they have become the threat to the American people. Serving from the state of Texas, unfortunately, we had to endure the very beginning of the measles outbreak. For the first time in 20 years, children are dying. That doesn't look like making us healthier again. In fact, a lot of people want to talk about measles, but the plague is back now. We had our first contact of that recently came out. And we know how the secretary feels about polio. Polio may end up coming back. Right now, President Trump, Secretary Kennedy, and congressional Republicans are perpetuating the most significant public health attack on Americans ever. In just a few months, they have diminished HHS's ability to respond to outbreaks and emerging health threats. They've dismantled teams that ensure Americans are consuming safe foods. They've weaponized the federal government against universities performing world-class research. They've implemented the most significant cut to healthcare in American history. These people hate it when American families have access to healthcare. They hate it when American families have access to healthy foods. They hate it when American families have access to affordable housing. They hate it when American families have access to affordable childcare because these people simply hate America. Nearly everything they have done makes Americans less safe and less healthy. The consequences of their actions are simple. More children will die and have. More children will go hungry. More children will live in extreme poverty. More children living with disabilities will lose access to school-based therapies and services. So, Dr. Frink, you're here to rubber stamp this agenda, an agenda that's so unpopular the Republicans are deciding to cheat in next year's elections. But nevertheless, let's talk about it. Dr. Frink, in 2021, you provided a presentation at the University of North Texas Health Speakers Bureau titled Women's Health. Do you remember that, yes or no?
Yes, I do.
Well, during this presentation, you spoke at length about the importance of vaccines. In fact, one of your slides stated, quote, clusters of under or non-immunization have the potential to foster transmission of vaccine-preventable diseases, including measles. Is this a slide from your presentation, yes or no?
I haven't reviewed that presentation recently,
So we're going to go you don't know. You work under someone who has become the face of the anti-vax movement. So who's right, you or the secretary?
Thank you so much for that.
You or the secretary?
I would like to tell you that Secretary
You or the
Kennedy
secretary?
is challenging us to use gold standard.
So you're going to
science
filibuster,
together.
and I only have 25 seconds. So I'm going to go with you, assume you, but you know that he's your boss. This administration has lost all credibility with the American people and our global partners. No one believes you care about improving health outcomes when you're slashing NIH research into Alzheimer's disease, women's health, cancer, and diabetes. No one believes you care about public health when you cut programs that support maternal and child health and eliminate Healthy Start. No one believes you care about children when you implement the largest cut to Medicaid in history. Americans know the truth, and the truth is that this administration, with the help of congressional Republicans, has unleashed the most significant assault on public health in American history. The people will die as a result. I yield back the remainder of my time.
Representative Jasmine Crockett delivered one of the most forceful and emotionally charged moments of the hearing, arguing that health policy cannot be separated from the economic realities facing millions of American families. Rather than limiting her remarks to public health alone, Crockett painted a much broader picture, saying that hunger, poverty, access to health care, and the cost of living are all connected. She began by introducing reports showing that farm bankruptcies have risen sharply, using those figures to argue that the administration's economic policies are hurting the very people responsible for feeding the country. According to Crockett, if farmers are forced out of business, food production declines, prices inevitably rise, and families already struggling to put meals on the table suffer even more. That point became the foundation of her larger argument. She rejected the idea that officials can simply promote slogans like "Make America Healthy Again" without addressing the financial barriers preventing families from accessing healthy food in the first place. Quoting scripture, she said that faith without works is dead, arguing that government must back its promises with meaningful policies instead of political branding. Crockett then turned directly to nutrition assistance programs. She warned that reductions to SNAP benefits and school meal programs would hit children the hardest. For many students, she argued, school meals represent their only reliable source of nutrition each day. Taking away those resources, she said, would leave vulnerable children even more exposed to hunger and poverty. The Congresswoman next shifted her focus to the Department of Health and Human Services. She accused the department of weakening America's public health infrastructure instead of strengthening it. Pointing to recent disease outbreaks, including measles, she argued that the administration's approach has left the country less prepared to respond to emerging health threats. Crockett warned that diseases once thought to be largely under control are beginning to reappear, raising concerns about declining vaccination rates and weakening public health systems. She argued that dismantling scientific research teams and reducing federal health programs only increases the nation's vulnerability. Her criticism quickly broadened beyond healthcare alone. Crockett accused the administration of cutting investments in medical research, reducing access to healthcare, limiting affordable housing programs, weakening childcare support, and reducing services for children with disabilities. She argued that each of these decisions contributes to poorer health outcomes for American families. Perhaps the most memorable moment came when Crockett declared that the administration simply hates America. It was an extraordinarily blunt accusation designed to emphasize her belief that government policies should improve people's lives rather than make daily life more difficult for working families. She then questioned Dr. Frink about a presentation he previously delivered supporting the importance of vaccines. Crockett contrasted those earlier statements with the current direction of the Department of Health and Human Services under Secretary Robert F. Kennedy Jr., who has become one of the country's most controversial voices on vaccine policy. When Dr. Frink hesitated to directly distance himself from his department's leadership, Crockett repeatedly pressed him to answer whether his own scientific views still aligned with the evidence he had previously presented. Instead of receiving a direct answer, she accused him of avoiding the question because of political pressure. Crockett concluded with a sweeping indictment of the administration's broader health agenda. She argued that cuts affecting research into Alzheimer's disease, cancer, diabetes, women's health, maternal health, and Medicaid would ultimately leave Americans less healthy and less protected. Whether viewers agree with every aspect of Crockett's argument or not, her message reflected a broader debate taking place across Washington. Should health policy focus primarily on reducing government spending, or should greater investment continue in healthcare, scientific research, nutrition programs, and social services? Supporters of Crockett argue that protecting these programs saves lives, reduces inequality, and strengthens communities. Critics counter that reforms are necessary to control spending and restructure federal agencies. But during this hearing, Crockett made one thing unmistakably clear. She believes the stakes are measured not simply in budgets, but in the health and lives of millions of Americans.